Okay, we're going to go ahead and begin. Thank you, everybody. We really appreciate you being here. My name is Michael Valere. I'm President and CEO of the Institute for Healthcare Advancement. We're the one who sponsor this conference and bring it to you. This is our fourth annual Health Literacy Conference, Arizona's fourth annual Health Literacy Conference. The theme for this year's conference is trust and healthcare. I just want to talk for a second about trust and the role that trust and health literacy brings in healthcare. When we're talking about how people interact with the healthcare system, trust is such an important motivator. On the patient side, that's really that trust in the healthcare system is really kind of moderated or fashioned or molded by people's past experience, the communication, how we communicate with them, and their cultural beliefs and values. And unfortunately, we only have control over one of those elements, which is our communication. So we really need to be kind of present and aware of that as we interact with our patients and with those who are interacting with the healthcare system. When trust is present, we have good engagement. We're working together collaboratively with the patient, with the person outside of the healthcare system, working together to really achieve a good outcome. When trust is not present, when that's been fractured by some previous event or by whatever other motivating factor, there's disengagement, there's mistrust, and a lot of times that relationship with the person, the caregiver, it splits, and we have that disengagement. We don't, the likelihood of having a great outcome is not as good. Trust really impacts the patient's readiness to do a lot of things. This includes things like filling out forms, talking about symptoms, acting on a treatment plan. And we all have an ability to affect that, and how we communicate, the empathy that we show to individuals, and how we really understand who they are, where they're coming from, and come meet them where they're at. When there's a lack of trust, this really has an impact on cost as well. When people miss appointments, when they don't understand discharge instructions, a lot of times there's rehospitalization, there's poor outcomes. And there's a cost not only in dollars and in resources, but also on the health and well-being of the individual that we're dealing with. So we have a great roster of speakers today. I'm very excited to see and hear what everybody has to say. I want to talk for just a little bit about who we are. IHA, the Institute for Healthcare Advancement. We're a 501c3 nonprofit healthcare organization. Our mission is advancing health literacy toward health equity. If you want to really see a little bit about who we are, please visit our website, healthliteracysolutions.org. Probably one of our most exciting programs that we've launched in the last few years is our certificate program. This is it's a program called the Health Literacy Specialist Certificate Program, and it comprises 7 specific modules or micro-credentials in different areas that subject matter experts in the health literacy field have determined these are the things that somebody needs to know and the things that somebody needs to be able to do in order to be considered a health literacy specialist. So please, if you have a moment, check that out. I think if you're really ready to continue on with your professional development journey, that's a really great place to start. I am going to give a nod and a big thank you to our 2023 sponsors. You can see those on your screen: Banner University Healthcare, Blue Cross Blue Shield Healthcare of Arizona, and the Arizona Complete Health. And also a big nod and thank you to the planning committee. These are the folks who put all this together, who are the ones who cobbled together all of these wonderful speakers. Jeanette Mallory, my buddy from a long time ago, who's the head of the planning committee. Thank you for that. Lori Tom, and she's from Blue Cross Blue Shield of Arizona Health Choice. Lori Thomas from Maricopa County Department of Public Health. Melissa Elliott, who's from the Area Agency on Aging, Region 1 Incorporated. And Julia Lawrence from the Refugee Women's Health Clinic, Valleywise Health. Just a few housekeeping notes for you all. We are on Zoom. Each Zoom session will start and stop with at least a 5-minute break between sessions. So if you have something real quick to take care of, you'll have that 5 minutes between each session. And the Zoom link is going to be the same throughout the conference, or you can visit the agenda page and the link is listed there as well. We will be sending out some evaluations, and the CE requests will be sent out at the end of the conference. So if you've asked for continuing education credits, those will be sent out. And please do take a few moments to fill out that evaluation form. That really helps us in understanding what worked for you, what you really enjoyed, and basically what maybe didn't work so well. Okay, so our keynote speaker is going to start at 8:20 p.m. in about 13 minutes, and that's going to be Dr. Alicia Willey. And her topic is going to be Cultural Navigators, Creating a Foundation of Trust for Successful Healthcare Partnerships. Once again, thank you for being here. We really appreciate your attendance. I hope you have a great conference experience and enjoy your conference. Thanks.